If you're over 65, your doctor may have told you that there are certain things that you should no longer do. And as a physical therapist, I often hear about these things from patients. In this video, I'll share 3 of the most common things that doctors tell patients that they should never do after 65 and what to do instead. Number 3 is never lift overhead. And this is advice often given to patients with shoulder pain or rotator cuff problems. And the reason for that is that when you lift overhead, you're most likely to pinch the rotator cuff tendons. And if you never put away dishes in a high cabinet, then you should never lift overhead. If you never have to get things off of a high shelf at the grocery store, then never lift overhead. If you have no desire to travel by airplane and have no concerns about putting things up into an overhead bin, then never lift overhead. But if you do want to do those things, then you should probably practice lifting overhead. But you want to do it in a way that's safe for your shoulders. And here's how you do that. When you lift overhead, there are a few tips that can help you prevent shoulder pain. And number 1 is maintaining shoulder external rotation. External rotation is the motion like this or like this. Internal rotation is the opposite motion, going in like that or going down like that. Now, when you move your shoulder into internal rotation, it moves a bump on your arm underneath the arch of the shoulder. And if you're lifting overhead with your arm in internal rotation, it does make you more likely to pinch your rotator cuff tendons. However, if you maintain external rotation, meaning keeping your arms more back like that when reaching overhead or lifting overhead, or if you're reaching up and forward, keeping your elbow in as opposed to elbow out, that will make you less likely to pinch your rotator cuff tendons. Additionally, if you're lifting something up into a cabinet ahead of you, you want to try, number 1, to keep the weight as close to you with a bent arm for as long as possible. So instead of reaching out like that, you're going to try to reach up and then come out versus going straight out like that. When you're out like this, especially with a weight, gravity has a long lever arm to pull you down versus the closer you keep your weight to the shoulder joint, the less torque there is. So lift it up close to you and then move it out to set it wherever you're going. And you want to try to get as close to the cabinet or shelf as possible. Additionally, you want to make sure to move not just your arms, but move your shoulder blades as well. So as you lift above your head, your shoulder blades should come out and away from your body. And if you are doing shoulder presses overhead, make sure that you keep the weights stacked close to you like this. One common thing I see people do is they do let the weight come more in front of them, which puts you into shoulder internal rotation and also puts the weight out farther away from you. So keep the arms in external rotation, keep the weight as close to you as possible, and use your shoulder blades when lifting overhead, and that'll put you at less risk for rotator cuff injury when lifting above your head. Now, when you're practicing lifting overhead, start out with lighter weights and progress to heavier weights as you get stronger. And that brings us on to the second thing that people over 65 are commonly told not to do, and that's never lift heavy weights. This is advice commonly given to people with lower back pain or osteopenia or osteoporosis so that they don't injure their back or break a bone. And if you never lift a box of cat litter or a bag of dog food, mulch, or topsoil, then never lift heavy things. If you enjoy inconveniencing your children every year to bring up your holiday decorations from the basement, then never lift heavy things. If you don't mind the disappointment on your grandchild's face when you tell them grandma's too old to lift you or grandpa's too old to lift you, then never lift heavy things. But if you'd like to stay independent and want to be able to lift your grandchildren, then you should probably practice lifting heavy things. Now note that what's heavy for you may be different than what's heavy for me. But start out with something that feels heavy but safe for you to lift and progress to heavier things as you get stronger. If you have concerns about osteopenia or osteoporosis, lifting heavy weights has actually been shown to build bone density rather than putting you at higher risk. But again, start with something that feels heavy but safe for you and build up from there. Now, when you lift heavy weights, you want to make sure you're using proper technique so that you don't injure your back. And here's how to do that. When you lift something heavy, you want to try to get as close to it as possible, or even straddle over top of it as you're able. If you do have to have it in front of you, try to get it as close to your legs as possible, and then keep it as close to your legs as possible when lifting. The farther away you are from something, the more torque it has on your back and the higher risk you're at for injury. So try to get as close to it as possible. Now, most people are familiar with the phrase, lift with your legs and not with your back. And while it's true that you don't want to bend over and lift something heavy like that, you don't want to focus so much on using your legs and not your back that you stay excessively arched and upright like this. Because especially if you have degenerative disc disease or spinal stenosis, being in an arched position like this actually jams your joints together and can potentially pinch the nerves in your lower back. So you don't want to be excessively rounded. You don't want to be excessively arched. Put your spine in a neutral position, get as close as possible, push the hips back and bend your knees. And then as you lift, you want to try to push your hips forward using your glutes, your thighs, your abdominal muscles to stabilize, and your lower back muscles some as well. What that would look like is pushing the hips forward like that, driving the hips in, and then lowering back down to the floor. Now, before we move on to the most common myth that people over 65 are told not to do, let me first clarify and say that I'm not just telling you to defy what your doctor tells you. I don't know you personally, but in most cases, absolute statements like always or never are almost never true. And in most cases, when your doctor's really busy and they only have a few minutes to spend with you, it's easier just to say not to do something than to explain when it's safe to do and how to do it safely. So if your doctor tells you never to do something, ask why you should avoid it. Ask if there are circumstances where it is safe for you to do. If there's an amount of weight that is safe for you to lift, and why. Because often doctors will just throw out an arbitrary but overly conservative number like 10 pounds. Finally, ask if there's a way that you can modify your technique in order to be able to do it safely. Now, if your doctor just says, I'm the doctor and I said so, or they're not willing to take the time to have a conversation, then it may be time to find a new doctor. After all, this video has probably gone on longer already than the average doctor's appointment. And if you are finding it helpful so far, make sure to give it a like and share it with someone else who may need to see it. Now let's move on to one of the most common myths that I hear about from people over 65 that their doctors have told them that they shouldn't do. And that's never do squats. And if you don't mind struggling to get up from chairs or off the toilet, then you should never do squats. If you hate the idea of getting down on the floor to play with your grandchildren, then never do squats. If you don't mind living in fear of falling because you're not sure if you can get back up, then never do squats. But if you'd like to be able to do those things, then you should probably do squats. Because if you ask me, the number one thing that you should never do after age 65 is never stop trying to maintain your strength and independence. Now, when you do squats, you want to make sure to use proper technique in order to do them safely. And you can learn 5 steps to safer squats for seniors in this video over here. Before you go, if you found this one helpful, again, give it a like, and if you haven't already, subscribe to the channel so you get notified of my future tips. Thanks for watching, and I'll see you in the next one.